Welcome to Stand Up for Doctors. I'm your host, Kim Downey. Thank you very much for joining us. This channel is dedicated to amplifying the voices of doctors, other healthcare professionals, and patients as they share their unique struggles, triumphs, and passions. My mission is to build connection and create advocacy for healthy doctors, driving positive change that benefits both doctors and patients. This is a space for everyone who cares about the future of healthcare. If you appreciate this content, please like and subscribe now. It really helps the episodes reach our target audience. And today I would like to welcome Dr. Brad Block and Dr. Ryan Molli. Thanks for joining us today, Brad and Ryan.
Thanks for having me.
Yeah, likewise. Thank you.
Okay, you're welcome. And by way of a very brief introduction, Dr. Brad Block is an ENT surgeon, host and creator of the Physician's Guide to Doctoring podcast, CEO of the Doctor Podcast Network, and a medical expert witness. And Dr. Ryan Molli is an orthopedic surgeon, three times boy dad, loving husband, orthopreneur, experienced provider, and co-host of Red Carpet Healthcare Solutions, which I was honored to be a guest on recently. 2 episodes, right?
Yeah.
So thank you. And I usually take the brief bio from your taglines on LinkedIn. So I'd like you to share more about yourselves. Brad, would you like to go first? What would you like our audience to know about you?
Oh, well, actually, I'm a three-time boy dad as well. So I'm in the three boy club. You can't smell my house over the Zoom, but that's a that happens. And actually I've rebranded the podcast. It's now called Succeed in Medicine. I still have to do all the things that go along with that. But so if you want to find me, succeed in medicine, right? Or if you want to succeed in medicine, however you define that, right? That's what we talk about on the show.
Okay, that's fantastic. And Ryan, what would you most like us to know about you?
Yeah, I'm a staunch private practice advocate, physician wellness advocate. Host two podcasts, the one that you mentioned, and another one that's was really what it started with, which is called Hey Sawbones, My Story, My Passion, where I actually have people from the community. I've had quite a few patients on that, and just gives people an opportunity to get to know more about me kind of outside of the operating room in the clinical setting.
Oh, well, I love that. And today we're going to be talking about how you're both surgeons and podcast hosts, and you both strongly believe that physician-run practices, big and small, are best for patients and physicians. And Brad, would you like to get the conversation started?
Sure. So I think Ryan and I have very different practices. I mean, we're both specialty surgeons, right? So very similar in that regard. But my practice, I can take no credit for it because I wasn't a founder. I joined and then became a partner. But we're the largest ENT and allergy practice in the country, and so we have 250 plus physicians. But we're still physician owned. There is a very clear path to full equity partnership, and if you join us and to do the things that we stipulate at the onset, in a few years you can have as much equity as me and as much equity as the founding partners, the ones that still haven't retired, although some of them have, or if most, if not all of them, have actually retired at this point. So it's a way to be in private practice without having to actually run the practice, but it's still owned by the physicians. And so we're very different in that regard. I feel like we're what medicine could be. So we have an elected physician board who all practice full time. And then we have a non-physician C-suite that really runs the practice. But the C-suite is really the arm of the board, and the board is elected by the partners. So we're really run, we're really are a physician run practice. If something's not going to be good for the physicians, we're just not going to do it. You're never going to have an admin that says, actually, you know what? We're going to be able to get a lot more revenue if you all work more weekends, because nobody's going to go, nobody's going to get elected to the board telling everybody that they have to work weekends, right? So if it doesn't work for the physicians, then it's not going to work for us. So everything that we do is done through the lens of the physician. And the great thing for the patients is because then there's no distance between who's running the practice and who's seeing the patients. The more distance you have between the two, the less the decisions are made with respect to patient care and that very sacred doctor-patient relationship. And so Ryan, your practice is dramatically different, also physician run. So, I'd love to hear, your perspective on that as well.
Yeah, it is quite different. 250, my head's spinning with that number. That's awesome. Strength in numbers. I'm the sole owner of my practice. I started it January 1st, 2018 at Whole Health Orthopedic Institute. I employ a total of 4 orthopedic surgeons, including myself. We're all subspecialty trained. And then I have 5 mid-level providers. They're all physician assistants. 4 of them work in the Orthopedic Institute. And then within our practice, we actually have a wellness institute that I started 2 years ago called Whole Health Wellness Institute. And we have a dedicated team of a PA, 2 athletic trainers, and then an administrator slash medical assistant, that the sole purpose there is for us to medically optimize our patients, whether or not if they're planning to have surgery or not. But the bulk of our patients have surgery by us, joint replacement. So I'm a hip and knee surgeon. One of my employed physicians, Dr. Frendak, is also hip and knee replacement specialist. We have an upper extremity specialist, and then we have another orthopedic surgeon that has since retired from operating. He's in his early 80s, and he still loves practicing medicine, but he simply sees patients in the office now, clinical setting, from time to time. But yeah, it's very different. The board consists of myself, and I have some advisors, but and I do ask and keep my other employed docs. I call them partners, although they have zero ownership of the practice. They've never invested in the practice, so it's solely on me. It's as you know, private practice can be challenging. We obviously practice in 2 different ends of the spectrum with regards to that, but I think it really works for me. I'm very much kind of that alpha male. I like to make decisions. I like to make decisions quickly. And I guess that's the one advantage that I have, is I don't have to take things before a board, although I do get input from the other physicians in the group before making any decisions.
So, Brad, if there's anything you'd like to respond to what Ryan said, and also I'd like to hear advice or suggestions from each of you for our physicians out there. Like, I know one surgeon, his dad started the practice, had it for over 30 years. He had also, worked in that practice, and at one point the overhead got to be so much, and just all the requirements and everything, that he ended up as part of a healthcare system. But I can guarantee you, if he could have remained independent, he would have. So, and I don't know if the specialties make a difference, Brad.
Well, the specialties don't necessarily make a difference, because in my area there's a group called Allied Pediatrics. They're not just pediatricians; they've now expanded into other specialties, but they started primarily as a group of pediatricians, and pediatricians are probably the least, if not close to the least, compensated of all types of physicians, and they're doing very well. Actually, that's where I take my kids. They refer a lot of patients to me, so I have a great relationship with them. And they, they, at least on the outside, I'm not there on the inside, but they appear to be doing extremely well. So the fact that otolaryngology and orthopedics are 2, of the better compensated specialties doesn't necessarily mean that you have to be in order to make it happen, because this group is making it happen. Another one of the advantages of being in a large group like me, like Ryan said, he's the sole owner, he's the sole partner. He has to be responsible for really everything. One of the advantages of my group is we have committees, which is probably going to hurt his head hearing, committees, because he doesn't have to run anything through a committee. Right? He makes a decision and he just acts on it. But we have committees that advise the board. And so if you join the practice and you're really into computers, right, you can become part of the IT board, the IT committee, or the website committee, or the EMR committee. Myself, I'm the head of the patient experience committee, because that's something that I'm very passionate about. I actually created the committee, and the board was like, "That's great. We'd love to have your input. Let's do this." I'm also now on a wellness committee, which is interesting, because why would a practice who's run by physicians need a wellness committee? right? Because if we're doing everything with the physicians in mind, right, you need a wellness department when you're a hospital who employs physicians. You want to make sure you don't lose sight of that so that you start getting attrition. So why would we need it? And what we found is actually because we're so big, sometimes there's so much distance between the practicing physicians and the board that not everybody is on the same page with everything. And so we need to take that into account, reach out to the physicians who might just choose to go see their patients and go home and not be involved at all. And we don't necessarily hear from them. And so now we need mechanisms to hear from them and find what their pain points are and make sure that we're solving for their pain points too, not just, the people that are more vocal and more visible and in more administrative positions. And so, if you want to join the practice and put your head down and see your patients and go home like an employed physician would, but not being employed, right? You will become a full equity partner. You can do that, or you can get involved in whatever aspect of the practice you choose and be as involved as you want.
Hmm. That's fantastic. I'll have to make sure my own local practice knows about you. How far have you expanded?
So we're in New York, New Jersey, Pennsylvania, Texas. We're not in Connecticut yet, but they are aware of us, and we'll see what happens in the near future.
Okay, great. Well, and I loved meeting you in person. We had that rooftop gathering of
Yes, that
LinkedIn
was
friends.
great.
And we'll have to do something in the fall. Dr. Bob Kornfeld, who you met, and I might do a book signing out New York City or Long Island. So we will keep you posted on that.
Please do. I'll be there.
And Ryan, anything that you wanted to respond to Brad? And also, if you are a single physician who would like to start their own practice, what do you recommend?
Well, Brad, I think it's great that you kind of started up the experience committee, the patient experience committee. That's honestly one of my biggest focuses when I created Whole Health. My bigger vision of Whole Health actually started in 2013, where my best friend and I, he's a real estate attorney in Cleveland. I practice in Northwest Pennsylvania. But at the time, I was living in Detroit, and we both married girls from Detroit, even though we're Pennsylvania boys. And we had this vision, he had just become a partner at his practice, and I was just become a partner in my practice in Michigan, private practice, before moving to PA, of creating a wellness community. And we termed it Whole Health. And it was a wellness community that had multiple medical specialties, but it also had real estate. It's where we would live, it's where we would work, and it had educational pieces to it because we just saw so much chronic disease. So it was a massive idea. It was a massive project. Our project budget was $292 million for two people. We went to a lot of venture capitalists, angel investors, got some great interest in it, and we had a site picked out that was 500 acres where we were going to build this. And literally within a year, my best friend became a partner in a different practice, and I had an opportunity I could not pass up moving to Pennsylvania. So took that route, but in 2018, I was like very committed to this concept of whole health. So started that with, again, the intention of creating the ultimate patient experience. Kim, to answer your question about young physicians, you don't even need to be young. But when I started it, I was in my late 30s. Not too many people that I know that start private practices from scratch these days. It is extremely difficult. And I don't say that to dissuade anyone from doing it, but I would say read a lot of books. Probably the book that inspired me most, and Brad, if you haven't read it, I highly suggest it, is Unreasonable Hospitality. Has nothing to do with healthcare, but Will Guidara, restaurateur, took an average restaurant, made it the #1 restaurant in the world based upon committing to just creating this ultimate customer experience. And for each patient that walks through our doors, just like Will, when they walk through his restaurant doors, we want them to feel like they're the only person there at the practice. So I have a hospitality manager that we have a cafe right in our office. So when I designed our office, built our office, I put a cafe right in our lobby so that patients didn't feel like they were in a traditional medical space. It's very warm. It's very cozy. I've heard many people say it looks like a ski lodge, even though we're in Northwest Pennsylvania. So to me, it's all about the patient experience. And every decision I make, I look at it as if my mom or my dad were walking through the front doors, and quite frankly, there's a plaque I created for them that has their faces on it right as you walk through the front doors. So a reminder to me that when I'm in there, everything that I do for our patients and every decision I make is focused on how you would want your mom and your dad to be treated.
I think that's amazing. I think that's another example of how important it is for the person that's running the practice to also be seeing the patients, right? The distance between who's running the practice and who's seeing the patients, I think the larger that gets, the more you lose sight of that, how important that relationship is. I saw it's interesting. I saw a LinkedIn post recently how someone was really trashing the fact that their hospital is paying more attention to outcomes than, or rather paying more attention to patient experience than outcomes. And this person was outraged that they're having fancy food in the cafeteria. And this to me sounded like someone who probably had pretty bad HCAP scores and was getting called into the principal office because they were being a jerk. And they were saying, well, but my patients, my patients have lower complications and this is how I am. And, you're just paying attention to patient satisfaction and not outcomes. And the problem is you can't look at it with blinders on. Like, patient experience is deeply tied to patient outcomes, because outcomes aren't all about, lack of surgical complications and surgical site infections. And right, a lot of people that go to the hospital don't leave the hospital, right? Everybody dies eventually. We can't change the ultimate outcome, but we can change the experience of people that have those outcomes. So I'm not saying we don't need to pay attention to those like complications and try to minimize that. We absolutely need to be doing that. In fact, I have a podcast episode that came out today that says medical error is not the third leading cause of death in America. That was a complete miscalculation. It made someone's career by making that outrageous miscalculation, but it's actually about 1/100th of what they said in that study. So I'm not saying we don't need to pay attention to complications. We absolutely need to do that, and we absolutely need to amend it. But we can also pay attention to patient experience and make sure that everyone, as you said, is being treated like they are the mother or father of the person that is running the practice, of the person that is working at the front desk. We have to pay attention to these things because not everyone's going to have a good outcome, but we can make sure that everybody has a good experience.
Well, I'm getting a little almost teary, like hearing you guys, because as you both know, my background is a pediatric physical therapist, so I understand a lot of these things from a clinician perspective. But having had cancer 3 times over the last few years and 5 surgeries, and experiencing a complication and seeing over 40 doctors, I've had all kinds of experience, and now my doctors that I have now are in my heart. And one of them, I'm doing this because one of my own doctors, took his own life. And I've actually had horrible experiences. And so just to know, to hear you guys talk about that, and Karen, actually my first surgery, it was a nightmare from the second I walked in till the second I walked out. And it was during the pandemic, right before the vaccine. So I can try to give people and systems some understanding and grace, but it really was, I could almost say, a night of terror. And so to hear, and I'm Claudia Comet also has recommended the book Unreasonable Hospitality. She's married to an anesthesiologist. She's a pharmacist by training, and now she helps patients. And she goes by that principle of unreasonable hospitality. And she wrote a book called Patient Empower Thyself. And I got to meet up with her in Florida. So I just want to thank you, because I know that you're not just saying it. I could tell that like you really get it and you really care, and every patient deserves, like doctors like you. But I'm also doing this because I understand that some of the reasons that doctors aren't able to do this now, right? And the things that have transpired where they're burnt out and moral injury and all of that. And that's also why I do these episodes, because there are doctors that are thriving, such as yourselves. And I want to share those messages of hope with other physicians. So one thing I'm wondering for doctors, some of them, Brad, from your perspective, it might be, say you're, I don't know, like a group of OBGYNs, right? And it's been hard for them to maintain, their own practices, really, every specialty. What can you suggest? Because it sounds like if you just start like partnering with other doctors, so say it's hard to start your own OBGYN practice now, is there suggestions or pathways to partner with other people in the same specialty to start practices that way?
Well, I think you need to find common ground and work from there. And the experience with my practice is there is significant strength in numbers, right? It gives us one, more leverage with regards to buying power, right? The more of us, the better prices we can negotiate for equipment, and actually the higher caliber C-suite we can have, right? If you're a 10-person practice, you can only afford a CEO of a certain salary. A 250-person practice is going to be able to get a much higher caliber, or be able to afford rather a much higher caliber individual, which we have. Our CEO is just so inspiring to speak to. Every time I have the opportunity to speak to him, he's just such an amazing, not a physician, but just an amazing individual, and really gets it. So there's that. There's economies of scale. And the other thing that you have the advantage of is you now have more leverage over insurance companies. So just the economic reason for having a larger practice, for merging a couple of practices together. And then the other thing that you can have a little more control over with regards to your local hospital, things like call, getting compensated for call. If there's a bunch of you that are in a group that can just like take over, or there's so many of you that they really want you to take call in their hospital, now you have leverage and you can start playing different hospitals against each other. And the other thing that I would say is the hospital is never going to love you back. And so, if you get together, you're like, well, I don't want to leave my hospital because I have these relationships. Well, if I join this group and our groups merge, we might have to, get privileges at a different hospital. The hospital's not going to love you back. You're going to leave. If you leave, like, they're going to fill your spot. They're going to find someone else. Right. And so don't have that be, you don't owe the hospital anything. Your patient's a different story. You got to do the right thing for your patients, but the hospital as an entity. So, there's so much strength in numbers between economies of scale, leveraging the insurance company, and being able to manage your relationship with the hospital, especially for someone like an OB, where that's going to be critical. That's so much, you're going to lose a little bit of your independence when you join with other practices. You're going to lose a little bit of your decision-making, your autonomy. They're going to make some decisions that you're not going to agree with, but there are so many positive to it with regards to those three things. And then there's more that you can outsource. You don't have to manage every single aspect of it, because then you can just find what really lights you up about running your practice, take care of that, and let other people manage the other stuff.
Mm-hmm. That's great, Ryan. Anything you'd like to respond? And also, if you'd like to talk about what your group is going to be planning, this episode will be published after your big weekend. But that's also, I think, a group of orthodox, and you're trying to find ways for orthopedic surgeons to maintain or have their independence.
Yeah, no, great segue there, Kim. So September 5th and 6th, we are hosting on my property where I grew up in 𝗕𝗿𝗱, Pennsylvania. It's called the 𝗕𝗿𝗱 Symposium. So it is a meeting unlike any other meeting I've ever been to or ever heard of. It's a small meeting by intention. We are only allowing 30 people, and we only have a couple seats left. And it's not just for physicians, it's for really anybody that's in healthcare. You don't have to be in orthopedics. I actually have an anesthesiologist coming in from Colorado. He was one of the first people to sign up and was super supportive of the concept. And we have 10 speakers. Half of them are physicians, and half of them are either healthcare leaders or CEOs of large entities. Zimmer Biomet, Ivan Tornos, Peter Varillo, CEO founder of Redefined Surgery. I have a local journalist. She works on personal journaling, and Kim Geiger is her name. Her husband is a primary care doc in Erie, Pennsylvania, and she actually reached out to me, and I was like, Kim, I think that's great. So she works with one of the medical schools in the area to help prevent burnout by journaling. And so this meeting, these talks aren't and we're not pitching anything. We have no corporate sponsors whatsoever. Each of us has, like, my talk it is all about the patient journey, the patient experience. And I created a 7-step protocol, which allows patients to see, how do I get from miserable hip and knee pain to not only less hip and knee pain and a good functional recovery, but this journey that these patients are going to go on over that year. And what it really is, though, is it's a win-win for everybody. It's a win for the patients because they know exactly what step of the process they're on. We give them all of the support, everything that they need for the recovery that's not included or covered by their insurance companies. But it's also a way for private practices, physicians, to create this elevated experience. Yes, there are additional charges to the patients, but it's going to allow the practices to actually be able to survive, because we have a horrible mathematical equation right now with ever increasing overhead. Every year it gets more expensive, and every year our reimbursement goes down. I can only speak for my specialty, but 20 years ago, hip and knee replacement, the practice would be compensated by the insurance companies on average about $8,000. Today, most patients would think it's $25,000, right? 3 times that. It's $1,100. $1,100 to do a hip or knee replacement. That doesn't go to the doc. That goes to the practice. That I have to cover 30 employees, all their healthcare benefits, all the medical supplies, 90-day global period. Any complications that arise during that period, I have to take back to the operating room. If it needs another surgery, free of charge. Hospital still gets paid. So how do we create solutions that are patient-focused and great for patients, but also physician-focused and good for physicians, so that we can maintain our autonomy, maintain our independence? So this is the revolutionary protocol that I'm really, really excited. We're launching it January 1st of 2026. So we're giving blueprints, and one of my fellow orthopedic surgeons is talking about a protocol he has called Ortho GPS, where it's kind of a lifestyle design type of thing, where physicians can build the type of life they want and practice based upon how they want to be outside of the operating room. So again, and then I said 4 slides at the end of every presentation have to be based on certain things. How do you prevent, if you were speaking, Kim, physician burnout or professional healthcare burnout? Where are your favorite vacation spots? We did some fun stuff like, what's your favorite cocktail or drink recipe? And then retirement plans, because physicians are notoriously very bad at business. They don't think into the future. They work until they feel like they have to continue working, as opposed to starting to build wellness and wealth earlier on in the career, so that they can practice medicine as long as they enjoy practicing it. They're not forced to continue to practice it to pay bills.
Well, I love all of that. And as you know, I've already had Adrian Towson and Renee Genova on. And I also just interviewed Brian Cohen. That episode will come before yours. And then afterwards, I've had a brief communication with Chris McClellan. I thought maybe he could come on to give some takeaways from this retreat that you want all of the doctors to hear about. And also, I am planning a physician retreat for the fall of 2026 at the Edith Macy Conference Center, Briarcliff Manor, New York. And I'm soon to upload, registration info, and that's going to be an incredible gathering as well. So I hope you both can come. Actually, there's a separate little room. It's either called like Treehouse or the Sun. It's a whole little block of rooms. So if you wanted to have your ortho guys there, you could have your own little building. So that's exciting. And Brad, what other messages would you like to send out to your physician colleagues?
Listen to my podcast. And if you're interested in starting a podcast, we've got a doctor podcast network. It's called the Doctor Podcast Network, just for that. No, I mean, I think these were both great examples of how there are very different models out there, both of which can work for physicians, right? You can be, if you want to be employed, that's fine. That's fine. But if you're unhappy being employed because of a lot of the regulations that are coming down, because you feel like admin isn't listening to you, you feel like there's too much distance between who's running the show and who's seeing the patient, and you think that that's causing your burnout, that's causing your discontent, there are a lot of options out there, and you just need to look for them, because, Ryan and I have very different practices, and yet we're both clearly love them and love how they're run. And so, you just gotta look. You just gotta look. There's a lot of options out there. And if you can't find anything, then you do what Ryan did and you create that opportunity. Easier said than done. I didn't do that. I just went to work for someone. So it's easy for me to say, but it's not just what we have going on that are your only options. There's a lot of options out there in private practice. And sometimes private practice gets a bad name because we are trained in academic practice, right? And they are ultimately all employed because they're employed by the hospital. That's what an academic practice is. And so we sometimes get a bad rap, but we do, I'm sure Ryan would say the same thing. We do excellent patient care. You can take care of really simple things, or you can take care of really complex things. It just depends on what you want to do and how you want to design your practice. But these options are out there, and you can hear how excited we are about our practices and our voices. And so if you're not this excited about your practice, then look into it, because there are lots of other options for you out there.
Well, thank you. And there's so many people willing to help. And in a minute, I'll ask you each to share how our listeners can get in touch with you. But as you were giving a plug for your podcast, I have to give a shout out to Dr. Michael Hirsch, my physician coach, and who is doing a podcast through your podcast network, correct?
Yes, he is part of the Doctor Podcast Network. Yeah, I love Michael Hirsch.
Yeah, me too. That makes two of us. And so, yeah, everyone listen to Dr. Michael Hirsch's Better Physician Life podcast, and also Ryan and Brad's. So, Ryan, what other messages would you like to share with your physician colleagues?
Yeah, I think as Brad was saying, there's multiple ways to skin the cat, right? And I think the first decision that you need to make is what's going to provide you with the ultimate physician wellness and satisfaction. Again, I've spoken out, Kim, about physician suicide on every single one of my podcasts, both of my podcasts, and physician burnout too. So trying to avoid that, trying to love your job, trying to create a patient-focused practice first and foremost. But are you better off as an employed physician, or are you better off as a private practice physician? And then if you make that decision, and again, this isn't against employed physicians whatsoever, it's just not for me. It's not my personality. It doesn't sound like it's for Brad's either. So if you do want the private practice, I think the next step is, all right, here's like your algorithm of choice here. Are you better in a large practice? Are you better in a mid-sized practice? Or are you better as like a solopreneur like myself? And then just reaching out to people, getting the resources, whether it's listening to Brad's podcast, my podcast, whatever it may be, attending meetings. But thinking outside the box, I think, is critical if you want to create a sustainable private practice. Going and visiting these practices, picking the brains of people that have been in these situations. And again, I think there needs to be some type of business training in medical school, physician health and wellness training in medical school, because we have these huge problems of burnout and physician suicide. So I think we're doing a disservice to future physicians by not providing ample opportunity to educate on like, if we can't be good ourselves, how are we going to be good for our patients and our staff, right? So again, love what I do, love the environment that I do it, but it doesn't come without challenges. So it's not like, oh, this is the ultimate thing. There's tough decisions that I need to make. There's people that sometimes, get hurt by those decisions, but you do the best you can. You take really, really good care of your patients, but don't forget to take really, really care of yourself.
Right. All of that is fantastic. And I also agree, from everything I've heard and learned, that med school, things have to change, and the culture of medicine has to change beginning in med school. So I'm working on, I don't know, I feel like I want to form some like international Stand Up for Doctors coalition, because these issues are ubiquitous over time and around the world. And my word of the year is impact. And I'm just trying to get these messages out here, see what we can all do together and amplify your voices. So thanks again for being my guest. And Brad, how can our listeners get in touch with you?
So yeah, it's the show was called Physician's Guide to Doctoring, but I am rebranding as Succeed in Medicine. So, find Succeed in Medicine on all the handles. I'm not on TikTok. I'm not on Pinterest, but I'm on the rest of the places. Or find me on LinkedIn, Bradley B. Block, MD, or succeedinmedicine.com is where you can find, or just look up Succeed in Medicine on all of the podcast players. I'm on all of them.
Okay, that's terrific. And Ryan, where can our listeners find you?
Same as Brad. I'm not on TikTok or any of those other things, but probably the easiest way and the most active platform that I'm on is LinkedIn. So if you just look up my name, Ryan Molli, on LinkedIn, you can find me there. And in terms of podcasts, I'm on all the major hitters there or platforms. Ours is a video podcast, so I think doing the YouTube one is probably the best because it's we put some theatrics into our podcast as well. And so I like to make it interesting from that perspective. But Kim, I just want to thank you for having us. This has been a very, very pleasant way to start my morning on vacation here.
Well, I love it. And the background is great. And thank you for taking the time to join me on your vacation. That's great. And
Of
then
course.
Brad might have some surgeries to do when we get off this call. So that's why I appreciate you both taking time out of your busy schedules to spend time with me. And how I always end is I say, in closing, to move the needle in healthcare, we all need to raise our voices and we all need to care about each other. We already know that doctors need to care about patients. Patients need to care about doctors too. So stand up, doctors, and let's stand up for doctors.